On today's episode of the Cruz Orthodontics podcast, Dr. Cruz is going to tell us all about this new 3D printer he has. It does amazing things. I can't wait to show it to you. Stay tuned. All right, Dr. Cruz, you have this new Lux 3D Creo printer. Can you tell us about it? Why is it going to help the patients and what is it?
Yeah, 3D printers have been around for quite a while now, and they've also been around quite a while in orthodontics. What makes this printer so special is in the past, really the only thing that you were able to print in an orthodontic office are study models or orthodontic models. And then off of that model, you can make appliances like retainers, for example. What makes this Lux Creo printer so special is it can now print aligners directly. And so rather than having to print a model of teeth, take that model and then go do what's called a thermoform retainer kind of manufacturing process where you suck down plastic over that model to be able to make the retainer. This
Yes.
printer now prints directly the aligner that can go into the patient's mouth. And so this is, I know this phrase is used a bunch, but it is a game changer because it really cuts down on the amount of time that it takes to make orthodontic appliances. But I'm sure we'll get into this. It also increases the quality of these appliances dramatically. The things that you now have control over to be able to make these clear aligners, move teeth and fit well and fit comfortably. It's an amazing, amazing printer.
All right, so you probably answered some of this. So why did you bring this technology into the practice? What was your original reason?
I'm usually I'm getting a little long in the tooth. I'm getting up in age a bit, so I'm always a bit hesitant to bring in new technology because I know that the learning curve can always be a bit longer than you think it's going to be. I try and
Yeah.
be optimistic, but it always ends up taking a little while. And so for many years, I've been looking at 3D printers, but I had a feeling that eventually they were going to be able to print aligners directly. And the reason I say that is if you look at big mega companies like Invisalign, that's exactly what they do. They don't print models of teeth and then make the aligners off of those models. They have the technology to be able to do it all in-house. And so I thought, gosh, someday, the little guy like me is going to be able to buy a printer and be able to make these aligners, print these aligners directly. But it's been years and years and nothing's been on the market until Lux
Hmm.
Creo. And so did a bit of research, making sure that it's also kind of tried and true. And so they've got a few years under their belt now. And yeah, that's what kind of led me to this.
All right, so let's dig a little deeper on how it's made. Like, how did it change how these aligners are made?
Quite a bit. So, thermoform plastic, kind of a fancy name. Basically, you would have these sheets of plastic. You would heat them up so that they would become soft and pliable, and then
Hmm.
suck that over the model to be able to make these clear retainers or clear liners.
Yes.
Lux Creo is different because it's not plastic. The aligners are actually made of resin. And we can actually talk a little bit about this. This resin it's insane. So the reason why I say that is I've seen videos, you can literally print an aligner, take a hammer to it, step on it, completely distort it, and then put it in boiling water and it will slowly go back to its original shape. I mean, there is no other material that I've ever seen that comes close to this. And so you hear about patients all the time that somehow damage their aligner or retainer,
Yeah.
and really you just have to make a new one in that situation. And so I think that that is going to be really helpful for patients that have retainers, and you want it to last for a long time. Retainers can be expensive, and so now you have this option of actually being able to heat the retainer up and get it to restore back to its original
That's
shape.
amazing.
It is amazing. I get excited talking about this, but what makes it also really cool is that, sometimes if you've worn a retainer, I think some people can relate to this. If you've worn a retainer for a while, you start to feel like, gosh, my retainer feels like it's a bit loose. With this Lux Creo resin, you basically put it in boiling water for a minute and it actually activates the polymers within that resin. So it's almost like you're getting a brand new retainer again. And so it kind of gives it some rigidity and stiffness. And yeah, what a great way to kind of restore your retainer back to new.
Absolutely. All right, so what other advantages does this bring to your patients?
Convenience is huge. So Even when you're sort of pushing and nudging the big aligner companies, the best case turnaround that you can get is maybe 2 or 3 weeks. Most of the time, it's more like 4 weeks. And oftentimes, it's a little bit of a letdown for patients. You know, they're excited, they want to start the process, and then you say, "Okay, we're going to scan your teeth, and we'll see you in a month." And it's like, "No, I don't want
Yeah.
to. I don't want to have to wait a whole month." And so now we have the ability to keep things in-house, try and be more vertically integrated with regards to our practice, to where we can literally have aligners ready in a matter of hours if a patient was really motivated to, get started soon, or they're going on a trip and they need the aligners before they're leaving. So convenience is a huge factor.
Does the technology make treatment faster or more precise in any way?
That's where the cutting edge on this is still developing. And so the short answer will be absolutely. This is going to be a much better way of moving teeth. And so for anybody that's had aligners, and we're guilty of it in our office, I oftentimes end up having to do quite a few attachments on teeth. They're those little tooth colored bumps that we have to put on the teeth. And what's happening now with these printed aligners is, one, they fit so well that you have the ability to use fewer, if any, attachments at all, which patients would love that, right? You have these
Wow,
clear
yes,
aligners, and then you have these
absolutely.
bumps on your teeth, and you think, darn it, I
Hmm.
wish I didn't have to have these. Um, the other reason why you're able to get away with fewer attachments or potentially no attachments is that you actually get to control the thickness and the thinness of the retainer in certain areas. And so oftentimes when you have an
Oh,
Invisalign aligner on, it's pretty much uniformly the same thickness all the way through. But what if you have a stubborn tooth? What if you have a tooth that needs a little bit extra force to be put on it? You have that ability to really dial it in and customize each aligner in different areas within the aligner. So you can really nerd out, you can really geek out on this. And I think that that's where a lot of us are now, as far as trying to figure out the best way to be able to do this. So as good as it is now, I think in the next few years, it's going to be, significantly better.
yeah, just being able to adjust the thickness of the aligner, like that was, I did not expect that at all. But yeah, I'm picturing the thermoplastic the old way, just fitting over. Of course, it's one uniform layer, but 3D
Right.
printing is like almost unlimited options on how you're going to make it.
And so to your point, what you've never been able to do with any of the aligner companies is you can actually also you can create little projections that go inwards towards the aligner, towards the teeth, to be able to sort of hold on and grab the tooth and move it in different directions. So if you have the aligner and you look at the
Ah,
inside of it, you can actually control how you want to print the resin into the aligner to be able to move the teeth. Totally new, something that's never really been done before.
is that part of why you can have less attachments because of that
Yes.
ability?
Yep, exactly. Yeah.
All right, so how does having this technology in-house improve the patient experience?
I think that there's this fluidity to the appointments, in that, now patients are able to come in and they have the scan done, which I know we've talked about our iTero scanners, but we scan their teeth and it's pretty cool. We actually have in the office the printer set up in an area where it's sort of visible, so patients can say, hey, what is that? And so to be able to kind of experience and live it with us is pretty neat, because they get to see the scanner, have their teeth scanned. They get to see the printer's working, it's making models, it's making aligners. And so I think that there's sort of a level of excitement of seeing, wow, this office is fully invested in really providing the best treatment possible, and they're doing it here, they're making it here. And so it's kind of cool to be able to peel the curtain back and see how these things are actually done. And so we've definitely noticed some excitement on the patient's end.
Okay, I think I know the answer to this question, but is this something that most other orthodontic practices have, or is it really new?
There are a decent number of practices that have 3D printers. Maybe 20-25% would be my best guess as far as having
Yeah.
3D printers. But once again, not this type of printer that can actually print aligners directly. I'm the only one in my entire kind of community or city that I know of that has this. But I think you're going to see that change rapidly. I think that as soon as other orthodontists start to hear that this is even available, and to have this ability of not being so dependent on aligner companies.
Hmm.
It's not to say that I don't appreciate Invisalign and that I don't appreciate Spark, but we as orthodontists tend to be pretty cutting edge. When you look at our specialty and you look at the way that our profession has developed over the last 50, 60 years, we have always really embraced having control over technology and control over how we treat our patients. And in some ways, these aligner companies have sort of pigeonholed us in being able to only do it their way. And so as soon as orthodontists start to understand that, oh my gosh, I can do it exactly the way that I want to do it in the patient's best interest, you're going to
Hmm.
start to see this become more popular.
Or what type of treatments benefit the most from a 3D printing version of the aligners?
I think for now, trying to do really simple cases are going to be the best way to sort of unveil this or introduce this to the community. So a good example would be a patient that I've had for, maybe 10, 15 years ago. We did orthodontic treatment for him, whether it was braces or Invisalign. And maybe they didn't wear their retainer the way that they were supposed to. And there's been a little bit of relapse, right? A couple of teeth have moved. They really don't want to go back into full comprehensive treatment again. It's probably going to take 2 or 3 months to be able to straighten the teeth out. So we can now scan the teeth, print 4 or 5 aligners, and in a month or two, we can get those teeth perfectly aligned again. The last aligner that they wear will end up being their retainer, so that keeps it kind of simple. And
Oh,
so,
really? That's
yep,
interesting. So it just becomes the last aligner?
exactly the last
It
aligner
makes sense.
becomes the
I
retainer.
guess
Yep,
from
yeah.
the patient's point of view. Okay.
The way that these retainers slash aligners are made is it's the same resin. So why not take advantage of the fact that you can make that aligner act like a retainer? And then to the point that we talked about now, a lot of patients ask me nowadays, everything is more expensive. Like, okay, well, how much are retainers and how long are these retainers going to last? Because you think, gosh,
Mhm.
if I have to spend $500 or $600 every year or two getting a new retainer, it starts to add up. And so this new resin is so durable, and the fact that you can heat it up and reactivate it, you think, oh, good, this is going to help last a long time.
All right. And lastly, how do you see this kind of technology shaping the future of orthodontics?
It allows the orthodontist to have complete control again. And so I think that there is going to be a completely new kind of explosion of growth within orthodontic offices in figuring out what the best way to use clear aligners is to move teeth. And so what we've done over the last couple of decades is we've completely handed that off to other companies for them to be able to figure it out. But you have to remember that a lot of these companies don't have orthodontists that are working for them. And so not only do we understand how to move teeth, but we also understand the biology of it all. And so oftentimes these tech companies will come up with what they think are solutions, but they don't necessarily comprehensively understand how to move teeth and do it in a healthy way and factor in the biology of it all. So now that orthodontists have complete control over being able to use clear aligners to move teeth, you're going to see new innovations within those aligners. I think that it's worth talking about braces. We've got that figured out because we've been hands-on with braces and wires for so
Of
long now that
course.
we've got
Yeah.
that pretty dialed in. But on the front of aligners, it's still relatively new. 10, 20 years now is when it's really gotten popular. And so I think that you're going to start to see a lot of new innovation.
All right. Amazing episode. Looking forward to talking to you again.